Hello, everybody. Welcome to Ms. McGuire video lectures, and today we're covering joints. This PowerPoint will be divided into two video lectures, part one and part two, because it's a longer chapter. Right, so let's go ahead and begin. Now, what is articulation? Articulation is a site where two or more bones meet. So articulation pretty much means joints. And function of articulations or joints include giving skeleton mobility and holding skeleton together. Now, if you want to classify joints, we can use functional and structural classification. So on this slide, we're going to use a functional classification of joints based on amount of movement allowed by the joint. So there are three groups of functional classification. Immovable joint, called thin arthrosis. Now, when you see this word arthrosis means joint. So thin arthrosis, immovable joint. Amphiarthrosis, slightly movable joint. Again, we see this joint within this name. And diarthrosis is freely movable joint. So again, this is functional classification based on how much movement is allowed by the joint. So here's, for example, sutures. That's our synarthrosis. Here's the intervertebral disc between vertebrae that allow you slight movement, amphiarthrosis. And here your hip joint or coxal joint, that is diarthrosis. I also mentioned that we can classify joint based on their structure, and specifically based on material binding bones together and whether or not a joint cavity is present. We have three structural classifications: fibrous joints, cartilaginous, and synovial. So if you look over here, you see our functional characteristic that we just described: thin arthrosis, amphiarthrosis, and diarthrosis, and structurals: fibrous, cartilaginous, and synovial. So you can see, you can guess that if you're talking about materials that binds bone together, if you're talking about fibrous joint, that will be fibrous connective tissue or fibrous membrane, connective tissue. No, I would say fibrous connective tissue between two bones. It's going to be cartilage, hyaline cartilage, if you're talking about cartilaginous, or it can be fibrocartilage as well, or it will be pretty complicated joint that we will have formation of the joint cavity and a capsule. That will be synovial. So we will discuss structure of each joint in more detail in this lecture. But here you can see class fibrous, cartilaginous, and synovial. Fibrous, bones united by collagen fibers. And here you can see mobility. So it's either synarthrosis or amphiarthrosis. Now they give you three examples of fibrous joints: suture, syndesmosis, and gymphosis. Cartilaginous joints, bone ends united by cartilage. If they are united by hyaline cartilage, we call it synchondrosis. If they're united by fibrocartilage, it's called symphysis. And this two types of cartilaginous joints are also synarthrosis or amphiarthrosis. So fibrous and cartilaginous joints by functional classification can be either immovable or slightly movable: synarthrosis and amphiarthrosis. And here's synovial joint: bone ends covered with articular cartilage and enclosed within capsule lined with a synovial membrane. And we have different types: plain, hinge, pivot, condyloid, saddle, ball in a socket, and all of them are freely movable or diarthrosis, which depends on joint design. Right, so here we have a summary of joint classifications that include both structural and functional classification, explains the structure and give you examples. So here's our fibrous joints, bones joined by dense fibrous connective tissue, no joint cavity. Most are thin arthrosis or immovable joints. We have three types: sutures, syndesmosis, and gymphosis, just like it has over here: suture, syndesmosis, and gymphosis. Now, suture. I believe we all very familiar with sutures because we just finished covering skeletal system and structure of the skull, and we know that bones of the skull connected by sutures. So sutures found only in skull. They are rigid, interlocking joints containing short connective tissue fibers found only in the skull, allow for growth during youth, and in middle age, sutures ossify and call synostosis. And by the way, the syn means come together, like synapse, right, where nerves come to the muscle, synostosis. So here we have connection between bones, right? So that's our sutures. So it's a fibrous joint and it's synarthrosis. Another example of fibrous joint would be syndesmosis. Bones connected by ligaments, band of fibrous tissue. Movement varies from immovable to slightly movable. An example will be synarthrotic distal tibia fibula joint. So we remember our tibia, that's the medial bone of your leg, and fibula, the lateral bone. And this distal joint between tibia and fibula is synarthrosis that is slightly movable joint, right over here, and this is our syndesmosis. Now, when you look at syndesmosis tell you structure, and synarthrosis tells you that it's immovable. Did I say slightly movable? I'm sorry. Synarthrosis is immovable. And we have interosseous membrane between radius and ulna that, according to your textbook, it's a diarthrotic joint. So it might be, because you remember we look at the membranes. And by the way, between fibula and tibia, we also have interosseous membrane. And yeah, some books tell us that it's diarthrosis because there is a movement within this membrane. So it's like freely movable. However, other textbook gonna tell us that it's not diarthrosis, but amphiarthrosis. So it's not going to be on your exam. If it's confusing, it's not going to be on your exam. But what can be on your exam, it can be the name of the joint. So the joint between tibia and fibula and radius and ulna is called interosseous membrane. And it's the fibrous joint that is called syndesmosis. Okay, and another fibrous joint, the last example of fibrous joint is gymphosis. It's a peg-in-socket joint of teeth in alveolar sockets. Teeth are not bones, right? So that's kind of, we just said articulation and joints when two bones come together, but in this example, we have bone and a tooth, but there is still a fibrous tissue between the bone and the tooth, and it's called gymphosis, or another name is periodontal ligament. So you can see over here socket of alveolar processes of the low or upper jaw, mandible, maxilla, and you have a tooth that connected to the socket through periodontal ligament or gymphosis. Right, so let's now go back and look at our diagram. I'm sorry, as the table. So we have fibrous joints, right? Bones united by collagen fibers. And you see over here, it says syndesmosis is slightly movable amphiarthrosis. Right, so let's just be consistent and just use this table as our reference. So all fibrous joints either synarthrosis or amphiarthrosis, and examples are sutures found in your skull, syndesmosis. Those are example, tibia, distal tibia fibular joint, right? That's our amphiarthrosis. And gymphosis is a joint between your mandible and maxilla and teeth. Okay, now we're gonna move to cartilaginous joints. Bones united by cartilage, no joint cavity, and two types, synchondrosis and symphysis. Now, synchondrosis is a bar or a plate of hyaline cartilage that unites the bones. They are thin arthrotic joints, so no movement. So, and the cartilage over here is hyaline cartilage. So if bones are united by hyaline cartilage, then by structure, we have synchondrosis, and by function, we have synarthrosis. And so example would be, you would be surprised, but this is epiphyseal plate found in the long bones. It's a temporary hyaline cartilage joint, and the joint between first rib and the sternum, that is immovable joint, thin arthrotic joint. Right, okay. Then we have cartilaginous joint symphysis. Hyaline cartilage covers the articulating surfaces and it's fused to an entering pad of fibro cartilage. So, well, we say that in the symphysis, we will have the fibra cartilage involved, right? Not just hyaline cartilage. We might have some hyaline cartilage because hyaline cartilage will cover the surfaces of the bone, but the bone will be connected by fibra cartilage. So you can see over here that the hyaline cartilage cover the surface of the vertebra, but the disc itself is fibrocartilaginous intervertebral disc. Right, so symphysis includes fibra cartilage when synchondrosis includes hyaline cartilage. So here's our two examples, bones united by fibra cartilage. And one example is intervertebral disc, and another is pubic symphysis, and both are amphiarthrosis, so they have slight movement. It's a strong and flexible amphiarthrosis. So let me just get rid of this red lines that I made. Okay, and now we, oh, by the way, I want to go back to show you again back to our table. Cartilaginous is a synchondrosis, hyaline cartilage, or symphysis, fibra cartilage, and they is a immovable, if we're talking about synchondrosis, or slightly movable, or amphiarthrosis, immovable synarthrosis, or slightly movable amphiarthrosis. Okay, so next are synovial joints. Synovial joints all are diarthrotic, so freely movable, include all limb joints and most joints of the body. So you can see we have a skeleton here, and almost all the joints that give you range of movement, either like movement in 3 planes or in 2 planes, but that's a lot of movement involved in these joints. That's why they are diarthrotic joints. Okay, so distinguished feature of synovial joint include articular cartilage. So if you see the bone over here, and this blue line represent our hyaline cartilage that is called articular cartilage. Then we have joint cavity or synovial cavity. So that will be a cavity. And it's a small potential space. Inside this cavity, synovial cavity, we have synovial fluid and articular or joint capsule. So we must have joint capsule. So we have joint cavity, we have joint capsule. Joint capsule, outer fibrous capsule of dense irregular connective tissue and inner synovial membrane of loose connective tissue. Right, so this is three distinguished features of all synovial joints: hyaline cartilage, joint cavity, and joint capsule. And within this joint capsule, inside we will have synovial membrane, and synovial membrane will secrete synovial fluid. Then we have other structure. Oh, here's, by the way, synovial fluid. I'm like, where's my synovial fluid? It's a viscous, slippery filtrate of plasma and hyaluronic acid that lubricates and nourishes articular cartilage. So, then we have some other reinforcing ligament, right? So number 5 and 6, we might have it sometimes. Sometimes we don't if it's a small synovial joint. But we have 3 possible types of reinforcing ligaments. We can have capsular, intrinsic, part of the fibrous capsule, extracapsular, outside the capsule, and intracapsular, deep to capsule, covered by synovial membrane. So those are reinforcing ligaments. So we have this articular cartilage, we have joint cavity, we have joint capsule, and we have synovial fluid, and then we have reinforcing ligaments. Either the capsule itself, of course, is reinforcing ligament, but we have also some ligaments outside or inside the capsule. And it has rich nerve and blood vessel supply. Nerve fibers detect pain, monitor joint position and stretch. Capillary beds produce filtrate for synovial fluid. So, okay. Now here's our friction reducing structure that associated with synovial joints. Bursa. Bursa are flattened fibrous sacs lined with synovial membrane. So if you look over here, that's a shoulder joint. And this is our coracoacromial ligament. And this is a humerus. Now, if this ligament, so imagine that's your shoulder, right? So your humerus moves pretty much all the time. So you have a movement of humerus. And if this ligament would be right on the top of the head of the humerus on a bone, then it would be lots of friction and it can damage and tear this ligament. That's why we have this nice sac called bursa, and inside we will have cavity with a fluid. So it's like little cushion. So bursa contains synovial fluid, commonly act as ball bearing where ligaments, muscles, skin, tendons, or bones rub together. So that's what bursa is. So that's an additional structure of synovial cavity. Another one is tendon sheath. Those are similar to bursa, it's just elongated bursa that wraps completely around a tendon. So again, that's your shoulder joint. Shoulder joint is the most freely movable joint in your body. So you have lots of movement, and where you have movement, when you increase the mobility, you decrease stability. So the more movement you have, the more possibilities of a damage. Your tendon can be damaged, So here's a tendon. Your ligaments can be damaged. That's why you can see both here. Bursa, right? It's subacromial, so it's under this acromion. Subacromial bursa, the sac of synovial fluid. And then, look, this is a tendon of a muscle, bicep brachii, and we have a tendon sheet. So again, it's an elongated bursa that covers this sheet completely, and inside it has cavity, right? And it has synovial fluid. So that's for protection of tendon and ligaments and bones. Tendon sheet. Synovial joint movement. A muscle attachment, muscle attached across a joint. So muscles always pull. So muscles have, let's start with muscles have origin and insertion. And muscle goes across a joint because they always want to pull insertion towards origin. So origin, it's attachment to the immovable bone, that's origin, and insertion of muscle, attachment to the movable bone. Muscle contraction causes the insertion to move towards the origin, and movements occur along transverse, frontal, or sagittal planes. Now, when we're looking at range of movement of the synovial joints, we can say they are non-axial, so slipping movement only. We will give an example. Uniaxial movement in one plane, biaxial movement in two planes, and multi-axial movement all around all three planes. And we have 6 types based on shape of articular surfaces. So 6 types of synovial joints based on the shape of that part of the bone that form joint. It can be plane, hinge, pivot, condyloid, saddle, and ball and socket. So here's our plane joint, and this is our non-axial joint. We have flat articular surfaces, and it produces short gliding movement. And the example would be the intercarpal joint. Inter means between, and carpal, between carpal bones. So between your carpal bones, you have synovial joint, and you have just a slight movement along the surfaces of the bone, right? Plane joint, non-axial. Then we have hinge joint. It's uniaxial joint, motion along a single plane, and it's like a hinge of your door, right? So you can only move in one plane, and it's allow you for flexion and extension only. So example gonna be your elbow joint. It's a hinge joint between the humerus and ulna, and specifically between trochlea and trochlear notch, right? So you can see that's your movement. You can flex and extend your elbow because of hinge joint. Next is pivot joint. A rounded end of one bone conforms to a sleeve or ring of another bone. It's uniaxial movement only. So pivot bone would be example of the so between C1 and C2, for example, of your skull, that allow you to rotate your head right and left. And another example, it will be proximal radial ulnar joint. So you see, here's your radius, here's your ulna. And remember, in the ulna, we have radial notch. So the head of the radius fits in a radial notch. So here's the head of the radius, and here's the radial notch on the ulna. And here is, we have the capsule, because it's a synovial joint. And this allow you to allow you rotation, but rotation happens in one direction only, right? So it's a proximal radial ulnar joint, pivot joint, uniaxial movement. Condyloid is another example. Now it's a biaxial joint. Both articular surfaces are oval, permits all angular movements, right? So, so here we have like a socket, and we have not a ball, because ball would be round. This is the oval surface. So it's allow you to move in two planes, right? And that would be example, metacarpophalangeal joint. So that's going to be the joint between your metacarpal bones, right? So that's a metacarpal bones that make your palm, and a proximal phalanges. And if you look at your fingers, you see what you can do. You can flex and extend, and you can move them to the sides. That's called abduction and adduction. It prevents rotation, however, right? Because of the oval shape, you cannot rotate. So that's why it's biaxial. Next is saddle joint. Allow greater freedom of movement than condyloid joint. Each articular surface has both concave and convex area, and this is biaxial. So here the example, so you have one bones that have both concave over here and convex, and here we have concave, right, and convex over here. So concave and convex, and it's kind of like sits. One bone sits within another bone, and the example will be carpa, metacarpal joint of a thumb. So we have carpal bone, right? And metacarpal bone of your thumb. And if you look at your thumb, you can see it has more movement compared to any other of your fingers, right? So you can flex, you can extend, you can adduct, abduct, you can rotate it, well, circumduct, not rotation. It doesn't allow for rotation, but it allow you circumduction. And you can do also opposition, right? So that's a joint, saddle joint. Okay, next one, we have ball and socket joint. So that's a multi-axial joint, the most freely movable synovial joint. And you will find it in your shoulder joint and your hip joint. So this one allows you all the movement, because you have a round head and a socket. And in the shoulder joint, the socket is shallow. That's why this is the range of movement is greater compared to hip joint. Because in the hip joint, the socket acetabulum is more deep. So hip joint is more stable, but shoulder joint is the most movable joint. So this you can do pretty much everything. You can have flexion, extension, adduction, abduction, circumduction, right? Like if you compare with the previous one, you can do a flexion, extension, adduction, abduction, circumduction here as well. Now what is adding here also rotation, right? So all type of movement by ball and socket joint. Okay, so here we have a type of movements: gliding movement, angular movement, flexion, extension, hyperextension, adduction, abduction, circumduction, rotation, medial and lateral rotation, and we have special movement. Special movement means only some parts of your body can move in that way. Special movement includes supination, pronation, dorsiflexion, plantar flexion of the foot, inversion, eversion, protraction, retraction, elevation, depression, and opposition. So let's look at gliding movement. So the first, our gliding movement. One flat bone surface glides or slips over another similar surface. So that's going to be our plane joint, intercarpal joints, intertarsal joints, and between articular processes of vertebra. So remember, we have superior and inferior articular processes of the vertebra. So those are also synovial joints with gliding movement, right? So that's, it's not movement of your fingers. It's not movement of your metacarpal or metatarsal. That's a movement of your carpal and tarsal bones. intercarpal and intertarsal joints. Angular movement, flexion decreases. So angular movements that occur along the sagittal plane. Flexion decreases the angle of the joint, extension increases the angle of the joint, hyperextension, excessive extension beyond normal range of motion. So, for example, if you bend forward your back, right, your vertebral column, that's going to be flexion. You go back up, that's going to be your extension. But if you bend backwards, then going to be your hyperextension. That's what beyond normal. It's beyond anatomical position, right? So here's our flexion of the head, right? So flexion. Then you go back to normal, right? Anatomical position. That's going to be extension. But if you bend it backwards, that's going to be your hyperextension. And this is with the vertebral column, right? So you have flexion, you go back to anatomical position, extension, and you bend backwards, hyperextension. So here it shows you flexion of the shoulder joint, flexion of the knee, right? Because look what happened over here. See how this angle became smaller? That means it's flexion. Here the angle became smaller too, flexion. Now, if you move forward your leg, then the angle increases, so it's extension, and you back to anatomical position, that's your extension, and then you move it beyond anatomical position. That's or can be, they call it extension over here, but it's also can be hyperextension because it's beyond anatomical position. Okay, so over here we have another angular movement, abduction, adduction, and circumduction. This movement occurs along the frontal plane. And abduction, like if a child was abducted, it's taking away. So you take your shoulder away from your torso, abduction. If you bring it back, that's adduction. Now, circumduction is when you add flexion, extension, adduction, and abduction. So in our lab, I will show you the difference between circumduction and rotation. So that's a little bit different. But circumduction is flexion plus abduction plus extension plus adduction of a limb. So it's describe a cone in space. So when you draw a cone in space, that's circumduction. So that's still angular movement. Then we have rotation, the turning of a bone around its own long axis. An example between C1 and C2 vertebra, that will be your rotation, and rotation of humerus and femur. So over here you can see lateral rotation of the hip at the hip joint and medial rotation at the hip joint, and you have the same in your shoulder joint. You can rotate laterally and medially your shoulder joint. And now we in a special movement. Movement of radius around ulna is called supination, turning hand backwards. So supination is when you excuse me, let me go back right there. So supination will be this position where you see the palm, like you have a soup in your palm, and this is pronation, turning hand forwards, right? So that's supination, and this is pronation. So that's a special movement, only radius and ulna. Dorsiflexion and plantar flexion, this is with your feet. Now that's your plantar, right? So to do a plantar flexion, you need to walk on your tiptoes. And if you start walking on your heels, that's gonna be dorsiflexion. So if you're walking on your heels, that's a dorsiflexion. You're walking on your tiptoes, that's a plantar flexion. Inversion turn sole medially, right? So it's shown over here, right? So that's the midline of the body gonna be right there. No, this red lines, I cannot get rid of them. So that's why I need to exit the whole presentation. So inversion, you move your feet, you move your sole, or you turn your sole medially, and eversion, you turn sole laterally. Right, so that's a special movement, inversion and eversion. Protraction and retraction, it can be with your mandible. Protraction is anterior movement to the front. Right, so protraction and retraction, you go back. You can also protract your tongue, take it out, and retract your tongue. Protraction and retraction you also can do with your scapula. Elevation, lifting a body part superiorly, so you can elevate your mandible as well, right? Mandible up, or depression, mandible down, and you can also do it with your shoulder blades. You can and with your shoulders, right? You can elevate and depress your shoulders. In opposition of the thumb, that's a movement in a saddle joint, so that the thumb touches the tips of the other fingers. And this is very a distinct characteristic of Homo sapiens, because only Homo sapiens have true oppositional thumb, so that we can touch every finger with our thumb. And if you look at your big toe, then you can see that your big toe cannot touch other fingers. So you don't have opposition of the big toe, you only have opposition of the thumb. Okay, and that's it for this lecture, because the rest of this chapter just cover selected synovial joint structure. So that's going to be for next lecture, and we cover actually all the structure of selected synovial joints during our lab. So thank you for watching, and I hope it was helpful.